Every month, millions of women around the world experience a cycle that is as natural as the phases of the moon. Menstruation, often called a period, is a fundamental part of reproductive health. Yet, the symptoms that accompany periods, including premenstrual syndrome or PMS, can feel anything but ordinary. For some, this time brings only mild inconvenience, while for others, it can be a source of significant discomfort and disruption. Navigating the world of PMS and period symptoms can be confusing, especially when trying to distinguish what's normal from what's not. Understanding your body and recognizing when symptoms cross the line from expected to concerning is an empowering step toward better health. Let's begin by exploring what typically happens during the menstrual cycle. The cycle, usually lasting between 21 and 35 days, is regulated by a complex interplay of hormones. In the weeks leading up to your period, estrogen and progesterone levels fluctuate, preparing the body for a potential pregnancy. When pregnancy doesn't occur, these hormone levels drop, triggering the shedding of the uterine lining. This process is what we experience as menstruation. Throughout this cycle, it's common to notice changes in mood, appetite, and physical sensations. Premenstrual syndrome, or PMS, refers to the array of physical and emotional symptoms that emerge in the days or week before your period begins. About 3 out of every 4 menstruating women will experience some form of PMS during their lifetime. Common symptoms include bloating, breast tenderness, mood swings, irritability, fatigue, and food cravings. Some women might notice increased anxiety, sadness, or difficulty concentrating. Physically, you might experience headaches, acne flare-ups, or changes in sleep patterns. These symptoms are considered normal when they are mild to moderate and do not interfere significantly with daily life. For example, feeling a bit more emotional or craving chocolate is a shared experience for many. Mild cramps, slight bloating, or temporary breast tenderness are also within the range of normal. Typically, PMS symptoms resolve within a few days after your period starts. However, the intensity and combination of symptoms can vary greatly from person to person. What's normal for one individual might not be for another. It's important to pay attention to patterns over time. If your symptoms are predictable, manageable, and improve with self-care, like rest, gentle exercise, and over-the-counter pain relief, they're probably within the range of normal. But what about period symptoms themselves? Menstruation can bring a host of sensations, the most common of which is cramping. Mild to moderate cramping in the lower abdomen, caused by contractions of the uterus, is common. Many also experience back pain, mild headaches, and fatigue. The flow itself usually lasts between 2 and 7 days, with most women losing about 2 to 3 tablespoons of blood during their period. A normal period is usually manageable with home remedies and does not prevent you from participating in everyday activities. However, there is a wide range of what's considered normal. Some may have heavier or lighter periods than others. The key is consistency. If your periods are generally predictable for you, that's a good sign. But sometimes, symptoms become so intense or disruptive that they signal something more than typical PMS or period discomfort. It's important to know when to seek medical advice. If your symptoms are so severe that they interfere with work, school, relationships, or daily functioning, it's time to take notice. For example, if you experience cramps so severe that you have to miss work or school, or if your pain doesn't improve with over-the-counter medication, this is not normal and warrants a conversation with your healthcare provider. Similarly, if you bleed through pads or tampons every hour for several hours in a row, or if your periods last longer than 7 days, these are signs of heavy menstrual bleeding, also known as menorrhagia. Passing large blood clots, becoming pale or easily fatigued, or experiencing shortness of breath may indicate anemia, a condition that requires medical attention. Severe mood changes are another red flag. While mood swings are common, sudden or intense feelings of depression, hopelessness, anger, or anxiety that persist or worsen during your cycle could signal premenstrual dysphoric disorder, PMDD. PMDD is a more severe form of PMS that can greatly impact quality of life. If you notice that your emotions are overwhelming, or if you ever have thoughts of self-harm, it's crucial to seek help right away. Unusual symptoms should also prompt further evaluation. If you notice a sudden change in your menstrual pattern, such as missed periods, irregular cycles, or spotting between periods, it's worth consulting a healthcare provider. Other concerning signs include severe pelvic pain at times other than menstruation, pain during intercourse, or unusual vaginal discharge. These symptoms could indicate underlying conditions like endometriosis, polycystic ovary syndrome, PCOS, fibroids, or infection. When seeking help, don't be afraid to track your symptoms. Keeping a diary of your cycle, noting physical and emotional changes, the heaviness of your flow, and any unusual symptoms can provide valuable information for your healthcare provider. It can help identify patterns, guide diagnosis, and inform treatment plans. Treatment for PMS and period symptoms varies depending on the severity and underlying cause. For many, lifestyle changes can make a significant difference. Regular physical activity, a balanced diet, adequate sleep, and stress management techniques can help ease symptoms. Some find relief with non-steroidal anti-inflammatory drugs, NSAIDs, for cramps, or with heat therapy, such as a warm compress on the lower abdomen. For those with more severe symptoms, medical treatments may be necessary. Hormonal birth control can help regulate periods and reduce PMS symptoms. Other medications, such as antidepressants or medications that target specific symptoms, may be recommended in some cases. Remember, you are not alone in experiencing PMS and period symptoms. They are a normal part of life for many, but you don't have to suffer in silence. Normalize talking about menstrual health with friends, family, and healthcare providers. Understanding what's normal for you and knowing when something isn't right is the first step toward taking charge of your well-being. If you ever feel uncertain, reach out for support. Your body is unique, and your experiences matter. With the right knowledge and care, you can navigate your menstrual cycle with confidence and clarity.